Hello, my name is Constantine Vardavis and I'm pleased to welcome you to the ENSP e-learning training program. This is the European Network for Smoking and Tobacco Prevention's accredited curriculum on treating tobacco dependence. This online training program provides the opportunity for healthcare professionals in Europe to receive training in the latest evidence-based practices for helping their patients quit smoking. Tobacco use is the single most important preventable cause of disease and death. The statistics are very clear. Each year, more than 650,000 Europeans die of tobacco-related illness. While we have seen important declines in rates of tobacco use in Europe, almost a quarter of Europeans still smoke. Tobacco use remains the largest threat to European public health and requires the attention of every clinician, politician and government official to address. There is in fact nothing more important that we can do for our patients who smoke than to help them to quit. Unfortunately, tobacco use has mistakenly been categorized as a habit, a lifestyle choice or a personal decision. Most smokers are in fact unable to stop smoking on their own. Why? The simple response is that they are addicted. Cigarettes contain nicotine and other addictive substances, while the actual cigarette itself has been designed to make them as addictive as possible. When a regular tobacco user attempts to quit, they may experience cravings and withdrawal symptoms. These symptoms can include all those listed here and can prevent many patients from quitting successfully. It is very important that clinicians understand that for the majority of individuals who use tobacco, it is a very powerful addiction, and that it should be treated as a medical condition and not a habit, a pleasure, a vice, or a lifestyle choice. As healthcare professionals, we have the duty to intervene and treat smokers' tobacco dependence without any further delay. I think it's fair to say that most clinicians feel less comfortable treating tobacco dependence than they might treat other major chronic disease risk factors. It is very important, however, that clinicians use the same clinical skills that we use to address other major chronic disease risk factors, such as diabetes, hypertension, and cholesterol management, to address tobacco use in our patients. This includes appropriate screening, assessment, and the development of a treatment plan to achieve cessation with patients. Clinicians, in fact, have a very important role to play in assisting patients with quitting. In fact, the majority of patients say that clinicians' advice to quit is a very important source of influence over their decision to quit. You should also understand that tobacco use is a chronic relapsing condition, and you should be prepared that most smokers will need your assistance through repeated quit attempts before they are ultimately successful. The good news is that the field of tobacco control has progressed significantly in recent years, and evidence-based therapies exist which can significantly increase the likelihood of quitting. The key components of successful cessation include the combination of education, behavioral support, and the appropriate use of available pharmacotherapy. It is important that all clinicians are familiar with these latest techniques for assisting their patients in smoking cessation, and that they feel comfortable with using these evidence-based therapies with their patients. The ENSP training program is designed to provide clinicians with training based on the recently released 2017 ENSP Guidelines for treating tobacco dependence. These guidelines consolidate evidence and make recommendations for effective smoking interventions to improve health outcomes. These guidelines include more than 80 evidence-based recommendations to guide clinical tobacco dependence treatments. One of these recommendations is that all healthcare professionals working in all practice settings, including primary care, specialty care, and hospitals, should receive training in evidence-based smoking cessation techniques and feel comfortable intervening with their patients who smoke. The ENSP e-learning program provides 8 initial modules developed by experts in the field. Each module provides a concise summary of evidence and practical tips for incorporating this evidence into your clinical practice. In addition to the didactic content, you will be able to view video case studies and download tools that would be able to assist you intervening with your patients who smoke. And at the end of the module, you'll be asked to complete a series of questions so as to assess your knowledge. It is important to note this training program has been accredited by the European Accreditation Council for Continuing Medical Education. And as such, you will receive an electronic, downloadable and printable certificate as part of the program, acknowledging your continuing medical education credits for each module you complete. From the main page of the ENSP training program, you will also be able to download tools and other resources. These tools include a consult form to guide the initial assessment, initial consults and follow-up visits with your patients. We encourage you to make use of these materials in your own clinical practice. I am very excited to be able to introduce the ENSP training program to you. I hope that you will benefit from this training program, that you will be able to download the provided tools, and that you will be able to use the knowledge and skills offered by this program to assist your patients with quitting.